Yes.
Good. 5, 4, 3, 2.
Good afternoon, everybody. I'm Dina DiOrio, Mecklenburg County Manager, and I want to thank you for joining us today. We had a great day today with Dr. Robert Redfield, the Director of the CDC. And he is here today to make a few comments and answer some of your questions. We do have a hard stop at 4 o'clock, so I'm going to let him come to the podium and allow you to ask your questions to him first. Because our time is limited, I will ask that you keep your questions related to Mecklenburg County, and if you have any national CDC questions, please contact the CDC Media Office. I want to thank our sign language interpreter, Richard Hefner, and I will say again that, as usual, our virtual press conference is closed captioned for the hearing impaired. And with that, I will turn the podium over to Dr. Redfield. Thank you.
Thank you very much. I also want to thank my colleagues here for just a really useful day talking about the COVID outbreak and really some of the remarkable work that's being done here in Mecklenburg County. So I want to thank all of you for that, first and foremost. Secondly, I just want to make a few points of emphasis that obviously I think people realize that this is the greatest public health crisis that we've had to respond to as a nation in more than 100 years. And it's really a marathon, not a sprint. One of the most important things that we have in the response to this outbreak right now, as we wait for the development of important countermeasures, particularly an effective, efficacious vaccine, is to fully embrace public health. And the most important aspect of that, I try to remind people that we are not defenseless against this virus. We actually have some of the most powerful weapons you could ask to have. And the most powerful weapon that we have that I know of is wearing face coverings when you're in public. So we ask the American public to all fully embrace the use of face coverings when they're in public. The second thing we have is the importance of hand hygiene. And the third is the importance of social distancing. These are not just words, these are very powerful public health tools. And then we can couple that with the traditional public health measures that we've used for decades of early case identification, contact tracing, isolation. But the most important thing that I can ask the American public to do is to fully embrace face coverings, to fully embrace careful hand hygiene, and fully embrace social distancing. And the last thing I'll say before I answer questions is I also appeal to the American public to commit themselves to protect the vulnerable. For most of those under the age of 45, this virus is not going to cause significant morbidity or mortality. But those of us that have significant medical comorbidities like obesity, diabetes, heart disease, kidney disease, chronic lung disease, and happen to be elderly, particularly those over the age of 65. With those comorbidities, this virus can cause significant illness requiring hospitalization and even death. So one of the important responsibilities that each of us have is to do our part to protect the vulnerable. So I want to congratulate the health department here for their continued excellent work in leading the efforts to confront the pandemic here in Mecklenburg County and also in the state of North Carolina. And I'm happy to answer any questions.
Dr. Redfield, this is Brett Jensen with WBT News. Last week, the two main hospitals here did something pretty rare. They issued a joint statement saying, even though they're at 80% capacity, they're completely fine and they're not stressed about hospital capacity right now, that they're going to continue elective surgeries. When should the public or the hospitals start being concerned about the hospital capacity?
Well, it's an important question, and it's really, I think this is one thing that it's important to leave to the local jurisdictions to make that assessment of where that resilience is. Obviously, one of the prices that was paid when we actually limited, as you know, elective surgery and sort of closed down a lot of non-essential medical practices, a lot of critical medical things didn't happen. 85% of the children in this country missed their important childhood vaccinations. Many individuals didn't get the appropriate cancer screening they needed. So I think we leave that to the judgment of the fine institutions you have. In terms of where that threshold point is it 90% capacity? Is it 85% capacity? But I think they're watching this carefully and making sound decisions based on what they know about the kinetics of this outbreak right now in this area. So I'd respect that.
Hi, Dr. Redfield. Ashley Daly here with WCNC. Quick question for you. It's our understanding you've been traveling the country, really talking with health officials in areas that have seen these COVID outbreaks, the hotspots, if you will. Tell me a little bit about what you talked about today with officials. What is your advice to them based on what you've seen elsewhere and now what you're seeing here? I guess if you could just some insight into what was discussed today.
Well, first I want to make it clear I actually came here to listen and to learn from sort of the front lines here in Mecklenburg County. Obviously, there's particular interest in the recognition that was really one of the first signals in the nation was that this virus was now disproportionately affecting the Hispanic Latino community. So I came to learn more about what they've learned as they've begun to evaluate, investigate the outbreaks in the Hispanic community and what they've tried and what they think may be useful in trying to mitigate that transmission. Obviously, I think the emphasis that this state and county has taken on the importance of face coverings is something we talked about. I think it's important, again, to emphasize, you can't emphasize it too much, that actually face coverings work. It's our major defense to prevent ourselves from getting this infection. If all of us would put on a face covering now for the next 4 weeks to 6 weeks, I think we could drive this epidemic to the ground in the country. So hopefully there'll continue to be more emphasis on that. I'm proud of the emphasis that North Carolina and Mecklenburg County has put on it. But we talked more about those issues, and I tried to learn from them as they're addressing the outbreak here, particularly in the Hispanic community.
Hi there. Thanks for taking some questions today. In your meeting today, did you discuss the crowds at several restaurants and bars over the weekend? And if so, do you think that's causing some of the uptake in cases, especially among young people? And if someone from the county could answer, maybe looking at any further restrictions on restaurants to discourage these crowds at night.
I'll make a general comment, and then if one of the individuals here want to comment specifically here, we have issued guidance on crowd gatherings, mass gatherings. We think it is very important to be very cognizant if you're going to have any of these gatherings that, one, face coverings are essential. They need to be universal. And secondly, the importance of social distancing and hand hygiene. I think that's fundamental. Secondly, I do think it's critical that we recognize that certain businesses that have a tendency to facilitate irresponsible behavior, such as bars that stay open late in the evening, I think really at this point in time in the epidemic, from the point of view of public health, they need to be closed. So I'm a strong advocate of closing bars, and I remain to be an advocate of limiting the restaurants so that there's adequate social distancing. But maybe one of the colleagues here from Mecklenburg wants to answer the...
So we had our policy call this morning, which includes the city of Charlotte and the 6 towns, as well as the hospital systems. And we are looking at the action that the governor of South Carolina just took in terms of closing the sale of alcohol after 10 p.m. We're also looking at Orange County, North Carolina, who also expanded their proclamation to stop selling alcohol after 10 p.m. at night. So our policy folks had that conversation this morning, and we are continuing to talk about it. We're not ready to make a recommendation, but we'll continue to talk about it over the next couple of days.
This is Derek Dellinger with Fox 46 News. This question is applicable really not only for Charlotte, Mecklenburg County, but also everywhere else. There are a lot of mask mandates going up pretty much everywhere. There are also these cases that have been going on and on and on for the last 4 months. Why are we seeing a spike in cases now?
You know, it's a very good question. And not to get too much in the weeds, I think it's important, as you know, in March, April, and May, we had, let's say, approximately 2 million cases in the country. But many of you probably heard me say several weeks ago that when we looked by doing antibody testing to determine how many people really got infected in March, April, and May, we found out that the ratio was about 10 to 1. So that means there was about 20 million people infected in March, April, and May in this nation. So there were quite a few cases in a day in March, April, and May. If you do the math, it would be more than 150, 200,000 cases a day. They just weren't diagnosed and recognized. Now, that's not to say we're not having a very significant problem right now, because we are. And we're seeing many more cases in young individuals. The average age has dropped by more than a decade and a half. We're sending really strong outbreaks, as you know, in South Carolina, Florida, Texas, Arizona, Southern California. So I don't want anyone to think that this isn't a very, very significant problem with marked expansion of new cases in those areas. Clearly driven by many more infections in the individuals that would be in the millennials or Generation X generation. That's why, again, I sort of appeal to that group to really listen to what I'm asking them to do, which is to embrace a face covering if you're in public, to wash your hands, to social distance, and to do their part in protecting the vulnerable among us.
Dr. Redfield, it's Allison Kuznets from the Charlotte Observer. Of some of those states you just mentioned, how concerned are you that Mecklenburg County and North Carolina could start to resemble scenes out of, for example, Arizona, where they are triaging patients? How concerned are you that in Mecklenburg County, our hospitalizations have nearly doubled since mid-May when we started to reopen?
Yeah, we're following each county across the nation really on a daily basis. One of the reasons I had some of my earlier discussions about 6 to 8 weeks ago with some of your leaders is we noticed that several of these counties seem to be having an increased number of cases, particularly in the Hispanic community. I do think that, the trends that are going on here right now are things are in a positive way. I don't know if Dr. Harris wants to comment or someone else, but I think the uniqueness that we're seeing right now in Florida, Arizona, Texas, South Carolina, and California are unique at this moment. None of us are going to try to predict. I think any of us that try to predict which way these things go, I think we don't know enough about this virus, but I think right now our high concern areas are the states that I mentioned. We continue to monitor closely North Carolina, but North Carolina has really seemed to make a marked improvement when we were concerned about North Carolina about 6 weeks ago.
Yeah, hi, this is Ruben Jones from Spectrum News 1. You brought up South Carolina. I am interested to know, being that that state has had significant increases, New York Times just called it one of the third worst in the world, actually. Wondering what that impact could be on Mecklenburg area hospitals when you talk about capacity. And I'm curious, we've seen some northern states talk about mandatory quarantines for people visiting from people down south. I'm wondering if anything like that could be considered, and if your thoughts on that, Dr.
I'm going to have my colleague here go ahead and answer that for you.
So we have been having conversations with our local hospitals about the impact that we're seeing from other jurisdictions, in particular in South Carolina. We know that we're going to have to keep a close eye on that. South Carolina is seeing significant increases and is of real concern to us. because of its close proximity to Mecklenburg County. We'll have to watch that carefully, but we do know that our hospital systems serve a region. They don't just serve Mecklenburg County, and so we do know that the individuals who are impacted by this in South Carolina may actually access service here. So we, again, just have to keep a close eye on what's happening and making sure that the hospitals have the capacity they need.
Dr. Redfield, this is Chandler Morgan from WBTV. My question is for Gibby, but I certainly welcome any comment from you as well. Is it concerning that Mecklenburg County now has 3 active COVID-19 clusters at daycares? Should daycares or families be doing anything differently? And what can be done so that it doesn't happen as a reoccurring pattern at these facilities?
We're working very closely with the daycares in the area, our environmental health staff, as well as our child care health consultants are really beefing up to be able to work with them very closely. The facilities that have outbreaks, what we have seen is that typically there are multiple children from one family that come into the daycare and are infected, and then we end up with a bit of a cluster where we have to do some significant work in that daycare. The daycares are very interested in working with us. Those child care centers are wanting to make sure that the children and the teachers are safe. So again, as we've been working with our long-term care facilities, we're doing the same level of work with those centers and hope not to see significant clusters as we move forward.
Hey there, this is Joe Bruno from Channel 9. I have a question for Gibby and Dr. Redfield. Gibby, my question for you is it a greater public health threat to have children in schools or at home? And then Dr. Redfield, I'll ask the same question to you.
Well, I guess I'm going to start, and she's going to come in right after me, okay? Is that all right?
No problem, sir.
I think it's important, and I've tried to emphasize this, that my own view is that it's a greater public health threat to our K through 12s right now not to be able to be in face-to-face schooling for a variety of reasons. 7.1 million children in this nation get their mental health services at school. Many students get their breakfast and lunch in school. Schools are really important for mandatory reporting of child abuse or sexual abuse. Obviously, the socialization that occurs in schools is important. And I think it's important on the other side, from the public health side, to realize that this virus, fortunately, really has very limited demonstrated ability to cause significant morbidity, mortality in children. To date, of over 118,000 of the first deaths that we had up from February to July, 51 were in individuals under the age of 18. So that when we looked at that, the risk of, say, death in individuals 0 to 18 was 0.1 per 100,000, or another way is 1 to a million. I really do think it's important as we begin to open these schools, we find a path to do it safely for these students to get back to school. The real vigilance that we need to have is making sure in the process that we're protecting the vulnerable, particularly the teachers that may have medical comorbidities, so that we can accommodate them and such that they're not at risk. There are some children, for example, that have significant comorbidities, either have cancer, have post-transplant, to accommodate those children. But in general, my analysis of this is the public health scale is way in favor of reopening these schools face-to-face so these kids can get the education that they deserve.
I want to say that I'm totally in support of what Dr. Redfield has just said. I think we are concerned about the health and welfare of our children who don't go back to school. I do believe there's real reason for them to be in school, but we do want to make sure that we're doing it in a way that keeps them safe, as well as keep the teachers and the workers in the schools safe as well. And so for that reason, I want to reiterate something that Dr. Redfield said before. If everyone is wearing a mask, then we have a greater opportunity to protect everyone in our community. So we need everyone to help us get our children back in school, whether you have children or not. So again, we want to appeal to our community, as we always have, to do the things you know you need to do, which includes wearing a mask, washing your hands, and social distancing. Getting our children back in school has to be one of our focuses right now. That has to be a priority for us. So please wear your masks.
Hi, this is Stephanie with Spectrum News 1. I was wondering if Mecklenburg County has started discussing opening a field hospital.
We have not reconvened those conversations. The hospitals, we've had several conversations, as you know, about hospital capacity. We feel comfortable with where they are today, so there are no ongoing discussions about opening up a field hospital. Dr. Redfield actually has to leave. He wants to say thank you very much for the time that you've given him.
I do want to thank you very much for taking the time. I will say once again that you all in the media are such a critical part of the public health messaging in our nation. And again, if I could ask you to really echo one really important message that I said, is that we're not defenseless against this virus. We have powerful weapons. They're right in our hands. It's wear a mask whenever you're out in public. Maintain social distancing and wash your hands, and do everything you can to protect the vulnerable among us. Thank you very much.
Thank you,
I
Doug.
have a question for Ms. DiOrio and also Ms. Harris.
Yes.
Well, and
Sure.
one I have for Ms. DiOrio. I know you mentioned in the Mecklenburg County Board of Commissioners meeting last week that you were pretty much dead set on not wanting another shutdown here because it would be detrimental to businesses. I'm just wondering if you can expand a little bit further on your reasoning for that, and also if what we're seeing is basically a step potentially towards another shutdown given the spike in cases. And also for Gibby, testing issues where the results have come back. There is a close personal friend of mine who went for a COVID test about a month ago, and he finally got the results back last week. Is there anything being done to address these backlogs, and could that account for some of the new cases we're seeing?
So let me just address the issue of the shutdown. I think, you know, what Dr. Redfield had said and what we've been saying to people for some number of weeks now is that the way to really combat this virus is to wear a face covering, wash your hands, and practice social distancing. And if we could get that right, we wouldn't really need to be talking about the potential for another shutdown. We've been spending a lot of time creating new messaging for our Latino community and really trying to get the word out about the importance of wearing a face covering. And so we, at this point, I mean, and it's not my decision, it's a group decision. That's the city and the 6 towns. We talk 3 times a week about where we are. We're not in a position yet to make that recommendation. Now, each town and the city could certainly make different recommendations. As I said earlier, we are looking at what South Carolina did in terms of closing restaurants at 10 p.m., as well as Orange County, North Carolina. We're looking at that based on some of the things that we're seeing here in Mecklenburg County, and we may make a recommendation that we want to follow suit, but that is under discussion at this time. But again, there's no formal discussions that we're having as a group about another shutdown. And with that, I'll have Gibby come over and answer the other question that you asked.
So about a week, a little over a week ago, it was recognized that we were seeing some significant delays in test results coming back from the laboratories. We were moving forward with expanding our testing rapidly in the county based on state recommendations and federal recommendations. But what we're understanding is that the testing laboratories have not had the capacity to keep up with that testing. And so what we have seen is a growing length of time when test results are coming back. And unfortunately, at times that ranges from 5 to 10 days. There are occasions, depending on the type of test and where you get it done, that you could get it more quickly than that, but we are seeing this happening a lot in our community as well as across the state and unfortunately across the country. We had some conversations with Dr. Redfield about that today. We have been having conversations with Mandy Cohen as well as the folks with the Division of Public Health in Raleigh about what we need to do around this. And they're continuing to look at other laboratories that may be available in Mecklenburg County as well as in the state to increase capacity. But that has become a problem for us. One of the things, if you'll remember when we talked about our testing plan, is we were looking from going from one phase to a second to a third, but a lot of that depended on the turnaround time on testing. And so one of the questions we're having with our testing partners in the community is whether we need to back off of some of the groupings that we said we were going to test to make sure that those that need it the most have it available to them. So that's where we're moving right now, is trying to prioritize a little bit more until it's more available. One more question.
Allison from The Observer. Could you talk about how that backlog in testing impacts your ability to do contact tracing? And from the contact tracing that has been going on in the community, where are you seeing some of these cases emerging? Are they coming from restaurants and breweries? What are you seeing as far as what you know from contact tracing?
So it definitely has an impact on contact tracing, because if somebody's test results don't come back for 5 to 10 days, we don't get the test results for 5 to 10 days. And at that point, that person's, if they stayed at home from the time they had a test, then they're almost ready to come out of quarantine. So obviously, that's not actionable data. That is not something that we can give the right advice on, because we don't even know the person's been tested. So again, we're concerned about that, and we're working with the state to try to resolve it. Remind me what the second part of your question was.
Where are you seeing some of these cases emerging from? Are you seeing a lot of these coming from restaurants or breweries, other businesses that reopened?
It's a little difficult to tell because of the information we're able to get from the individuals who have tested positive. We are continuing to have some challenges with people not being comfortable having conversations with us, not wanting to have conversations with us, and being hesitant to let us know about where they've been, what they've been doing, for any number of reasons. What we are seeing is that the positive test results we're getting are pretty widespread. Individuals could have come in contact with the virus at a bar or restaurant, but they could just as easily come in contact with it at work or at the grocery store or other places. We've got such widespread community involvement at this point. So there's no way to really pinpoint it to those bars or restaurants. But as infectious as we know this virus is, if you look at some of what you're seeing on social media, with the lack of social distancing and definitely the lack of masking in those types of environments, we know that that likely is one place where it is being transmitted. And I think we're done for the day. Thank you very much.